Welcome to the webinar on health history in MMS Generations. I'm Beth Elliott, your trainer today, and we'll be going over how to set up your health history codes, how to enter them, how you can show them to the teachers, what conditions the students have, and how to get reports out. So we're going to start with just going through what sort of information you have. So we're going to start with editing the codes that you're going to use in health history. And you do that by going under Health, More Health Editing Jobs, and you're going to edit the health condition codes. The codes are where you have the history of things like your communicable diseases. CMD is communicable disease. And so that's things like chickenpox, German measles, and so on. Below that, we have what we have HCN, which is your health conditions. And these are information about the students. They might be diabetic, they might have asthma, they might have who knows what, and we need to find out what that is and put it in there in case you need to notify that. The communicable diseases do not have a subcategory, but the health conditions do, and all of our sample or default health conditions have the same subcategory of HLP, which is just that it's a health problem. I didn't put the descriptions in here, but CHC is my chronic health condition, and DDD is a developmental disability, and PRN is not come back to you whenever they need. PRN is a physical related need. So that's where those are. And they grouped them like that to give you a way to just say, okay, show me all the physical related needs, and then I don't have to look at all the other stuff. I just want to know who are the ones that need wheelchair, that need crutches, a hearing aid, or things like that. But right now we just lump everything into health and physical related need. The code has to be an up to 3 character field, letters, numbers, any combination, and it's your choice what that code is. In the sample data, what they did with the health conditions is the first character of the code is related to the alphabet of what the code is. So all my A items start with A, and then all the B stuff starts with B, and so on. Whatever you want to use is your choice. Now I have one now that I've added for other reasons where I put in medical alert as 000 because the letters sort after numbers. It's numbers, capital letters, lowercase in the sort order. So sometimes it's nice to have something that'll show up right at the top of the list. And you can put in a description of what it is, and if you want to see the ADD or you want to type out the attention deficit disorder, that's entirely your choice, whether you split them out or not. You can indicate whether or not a health condition is confidential or not. So something like a student who has cancer or a seizure disorder or something else like that, you might want to flag as confidential where you know about it but it's not broadcast anywhere. The sort order doesn't have to do with the health history items. It has to do with your immunizations that are at the bottom of this list. So we have more immunization stuff down here, and that's where the sort order comes in, because that's how I group my different types of immunizations together. But that's when we go over immunizations and state requirements. The next thing we'll be working with is whether or not to post health alerts. The items that you check as post health alerts are going to show up for the teachers unless they're confidential. So you can have something that you are notified about but the teachers don't know about. And you'll get an exclamation on the student record that says, yoo-hoo, there's a health alert on this student. And then there's also a separate health alert for the school lunch programs for something like, I want to say class roll, and that's not the right name. But if you have a lunchtime program that is coordinating an MMS, then it's going to let those people know that there is an alert on this student. So I checked the food allergy for the school lunch program. And if I had additional items in here, like if I wanted to have an allergy that specifically states peanut allergy, I would go up to the yellow plus. I would say that it's a health condition and I want to add a code. So if I want to keep it in the A's, I'm going to put an A in here, and since 03 isn't used, I'm going to go ahead and put in A03, click the OK button, and I'm going to put in allergy peanuts. And it doesn't give a subcategory by default, so you need to add it so it groups with the others. I can post that as a health alert, and I want to post it as the school lunch alert. So I want to do that with both of those. And now when I look at students, I can give them alerts in both ways, both as an overall food alert and also that it's a peanut alert. And I can have one of the others. And if I need another one, I might put in that I need rather than the ground nuts of the peanuts, I might need a tree nut or other nuts so that I can have both of those out there. What codes you use are entirely up to you. We have a default set of codes that will let you use, if you wanted a place to start with, or you set up whatever you need. As you scroll through the alerts, you might decide that, I don't use that one or I don't need that one, so that you can go ahead and go in and remove it. There are codes in here that were, whether or not the student is an exchange student, either at your own school or that you sent somewhere else. So in that case, you might opt of, I don't use those codes, so I can go up to the red X and delete them, saying I don't need that code. Do I want to see whether or not they have exemptions to their immunizations, because that might be why they're having a reaction of some kind. If there's codes in here, as I said, you're not using, there's a bunch that are further down in the S's that have to do with SPEDIS. That is a special ed type thing for New Hampshire. And if you're not in New Hampshire, then there's no real need to keep it. And you can just come in here and delete them. So make the list be important to what you have. And anytime I'm in here, I can always go up to the printer button and print all of them. So if I just want my health conditions and the communicable diseases, I can click just those and print. I'm going to have one page that has the communicable diseases on it, and then my next page is going to start my health conditions, and it's based on each subgroup. So it gives me a way to have a look of what I have and then decide, do I want to keep it or not keep it. We will recommend that you have the same health condition table or the same list of codes for all schools in your district. That way, as a student moves from one school to another and that health history goes with them, you're going to want to know that. Because now it's, I've started at the elementary, I'm feeding the middle school, who's then feeding the high school. I want the same code to mean the same thing in each school. So if A03 is peanuts at this school, I want it to be peanuts at all schools, because I don't want it to change its meaning as I go from one school to the next, because that can really cause problems. And to help do that, there is the facility here at the bottom that you can set up a path of where you want to copy the table to, and by default it's going to be in your work folder. And if I put it in there, I can say I need to know what my school code is, but I can say from school code, copy my table here for code 910. And I know I'm school 910 because I've looked here. I can now go to another school, go into my health condition codes, and I can say, I want to go find where those codes are. So I'm going to go back down to my work area for nurse. I'm going to come from code 910 again, and I want to copy them to import into this school so I have the same code. So if I scroll down, I'm going to see that I don't have A03 here, but after I import, I will. So now when I scroll in, there's my A03 with my peanut allergy. So it just makes it easier to work with this if everybody has the same codes. And usually one nurse becomes the keeper of the list, and that way you know what's going on with it. So easy to work with. So you come up with a master list. Once you have that, then we're going to close out of this list. I'm actually going to go back to my high school. The red Save and Exit button that I clicked on happens to be, it did a save and exit, so it saved it first and then got out. It could have also done that if I hit the X in the corner, but it would have asked me, do I want to save or not? So now I'm going to come into my little H up here with the student's health history. Now this button is the same as if I go under Health, More Health Editing Jobs, and I edit the student's health history. Both ways get me to this screen, so it doesn't matter which way I come in here. The toolbar up here is just a faster way to get there. So same place. Now Amy comes up with an alert, and that's because she has one or more items that we said were alertable. And if I click on the alert button, it's actually going to show me that she has a bee sting allergy and diabetes. So even if I was in another area of health, I would still see that she has that alert. And I don't have any comments in here on her of, severity or other things. When I come in, you have the ability to put in a code. You give it a date. If you fill in a date, it's going to show you the age of the student for that date. So I can see that between July and September, she's 2 months older. On an individual basis, I can flag any specific item that I've added to a student as confidential by just checking it. So that gives you the option. If you have made the condition confidential in the health condition codes table, when you come in here, it's automatically flagged as confidential. So it makes that easier to work with. You can click on the note and put in any kind of a note that you need. It might be on the bee sting, how it's being handled. And that could be that you have an EpiPen in the office, so you know what's going on. So it gives you that information. And when you do add a note, the button itself, the note is now started with a capital and it's in red. So that's sort of a yoo-hoo, there's a note. When I look at the alert, I'm going to see that and see whatever note I type in here. The teachers will not see the note. They only see what the condition is. So you can add as many things in here as you need. If the student has had a history of diabetes or a history of bee stings, then the note could very well include that you've known since maybe the 2010 school year. So you can put that information in of how long you've known. And it might get renewed each year. The advantage of having the current date or a current school year date in the date range when you look at this is when you go under Health, More Reports, and you print a health tally report. Because if you print a health tally report by month, you're limited to a 1-year span, a 12-month span. So I can't go back 3 years and still show it because I run out of paper. It's basically why they limited it to that. So having it in the note how long you've known about it is also helpful. Things like asthma, is this a new condition or is this an existing condition? Or on the asthma, how severe is it? So very easy to put things in and see what's going on. Right now, the order of the health conditions, when I drop the list, is in code order. So this code over here. And if I go up to the bee sting allergy, I'm going to see I have bee sting, drug, environmental, food, but I'm not necessarily seeing the peanut allergy. If I change this to the description, and it will remember that you changed it to description when you log out and log back in again, now when I drop the list, I see, oh, here's peanuts, right in with the other allergies. So it doesn't matter what code I give it, I can still see it grouped by what the description of the allergy is. So that makes it very easy for you to use. So if Amy also had a peanut allergy, I could just come in, add the condition, drop it. I could type my ALL just at the beginning of there, and then I can page down to get the one I want. Hit enter. It goes to the top of the list because there is no date yet. But I can come over here and type in the date, so I could put today in. I can put a 2-digit year or a 4-digit year. Either one the system will convert for me. It'll still give me their age, and I can put a note in, mild case, not a severe case. But that just gives me some added information. If I hit the X in the corner, it's going to go ahead and ask me, do I want to save the changes? So yes or no, or I can cancel and stay in. The blue diskette here says save the changes, but stay where I am. The red diskette is a save and then exit out. So the either save is done when I click here and say yes, and it just, I have to have an extra question when I do here. If I go to locate another student through the stack of folders, and I can just come down to any student I want, when I click OK, it's also an automatic save. So when I go from one student to another, it saves it, whether I'm using the arrow keys or the stack of folders. So I can go ahead and give Charles that he has asthma. That's interesting that it's not going there. Well, it helps if I spelled asthma right. So I could be at the top item here and just type my AS if I know that's the beginning of the spelling for asthma, and I don't even have to drop the list. It's going to find it for me. And then I can just come over and put the date in. This note, by the way, will grow as big as you need. The physical limit per note is a gig. So if you wanted to type in all of War and Peace, it'll let you. I don't know if I'd want to read all that, but it'll let you type it all in or copy and paste it. So I can click OK, and there's the note for Charles where he has his asthma. If Charles had also had chickenpox, I can come in and add another line, only this time I want to put in that he had chickenpox. And I can say when he had the chickenpox. Now in this case it would be more when he actually had it. So he had it in 2000. So when he was 5, he had chickenpox. If he had chickenpox, this actually relates back to the immunization requirements, and it will let them know that he had the chickenpox, therefore he is compliant in the state immunization requirements because he actually had the disease rather than having the immunization for it. So either one of those ways you can put those in. So it's just a matter of add in whatever you need. You can, if you want, add in something like they just have a medical alert. So I might want to come in here, put in a medical alert, and that's just enough to say, flag that for the teachers, there's a medical alert, come see me. So it's a way to flag it for the teachers without doing anything beyond that. And it might be that it was at the beginning of the school year, and if you want in the note for your reference, you can put in what sort of note it was. Whatever it is that you want to put in the note. If you decide you don't want the note anymore, you can just sweep across it, go up to Edit, and cut it, or hit the Delete key. Any of that works in here. So sometimes this is just a way to, if you don't want to give the teachers too much detail, it's a way to do that. I had a question of why things were not all confidential. Depends on what the notes are, because unless you give it to a student, it depends on the condition. We don't automatically flag everything as confidential until probably about 2 years ago. The teachers never saw the information, so it didn't matter whether it was confidential or not. So that's why there's the confidential flag or not. If you want to start by making everything confidential and then taking off the ones that aren't, that's your choice also. So it's just how do you want to look at the data. And I have a question of where do the teachers go to see the information? There's a couple of different places. One is if I go log into the teacher portal, there is a place in attendance where we'll be able to see it. So we just have to give it a moment. Okay, so now that I have the login for the teacher, I can go ahead and come in. So for the teachers to see it, I would go under attendance and view health alerts. And in here is where they can see if this has been turned on, whether or not the students have health alerts. So it's going to generate a class for this section of geometry. If we give it just another moment, it's going to bring that up for us. So I can see that Amy is an allergy to peanuts, bee stings, and diabetes. And she's the only one in this class that happens to have any allergies or any health alerts. At the bottom, it gives you a male and female count in the class, and it also lets you know how many male or females have alerts. Not how many total, but just whether or not there are any. If I wanted to check my next class, all I have to do is just click the next class, and it will automatically recompute and show me who in this class has any alerts. So it's very easy for the teacher to flip through their classes, and that can include a homeroom, if that's what they have, to be able to see are there any alerts or not. So that's how the teachers will get the information if they're on the teacher portal. The question of whether you can upload the health information for the teachers as well. If you have a teacher database, like right now I'm in the school database, I can do it there. If I had a separate database for my staff, then I could go ahead and put them in there instead. So it depends on how I want to do it. And some schools keep a staff database so they can also track attendance on their staff as a nice, easy way to work with it. The other ways to see the health alerts is if I go back into generations, and if I'm going to briefly go into the user accounts, and when be like that. Excuse me a minute. So it told me that only the administrator, except I can't spell. I always try to put too many R's in administrator. If I come in to the user accounts, I can say whether or not, say, the guidance counselor. If I go into edit that user and I go into health, I can check whether or not they may view the health alert rosters. Because if that's not checked, they don't get to see or they can't pick the option that lets them view whether there's health alerts or not. And when I do teachers, excuse me as I come down, when I look at a teacher, there is less of that here. That's more in the admin portal on the menus of where I can say they can see that or not. So it just is a matter of do you or don't you. And if you don't want any of your teachers to see it, then you just don't check anything for health alert. So it just, there's different areas where you can say whether you want to do that or not. So let's come back in as the nurse. If I go in under the biographical, print biographical list by field report, there is an option if you can view the health alerts to include them or not. So I could actually do a homeroom list by the homeroom teacher and include my health alerts. And I can also opt to skip students with no alerts. And if I leave it this way, when I print, I can see who has the health alerts or not. Like Charles here has asthma. And as I go through, I can see who has what. If I say skip students with no alerts, then I'm only going to get a list of those that have the alerts. which makes it a little easy for you. And I can opt that I don't want to start a new page every time it changes. So now I have sort of a brief look here of who does or does not have alerts. If I don't want to break it out by teacher, I might want to do it by grade level or another field. You know, if I look at grade level instead, now all the kids in the same grade level, I'm going to be able to see who has what. So if they have given someone in the main system, not the portals access, then they'd be able to look this way to see whether there's alerts or not. There's 4 places where you can show the alerts. One is in the biographical list by field report. The other places are under scheduling. If I print class list, which this user is not allowed to do, then I can do it there. So let's log in as someone else. And whether administrator has access to all of health or not is a school district decision. There's some of this that with HIPAA, that because teachers and school staff are in the need to know situation, this information can be shared. So if I go back under schedule and I print class lists, I'm going to have the option when I get into my detail of whether or not I want to show the alerts or not, and I can limit how much of the alert I see. But they only see the description of the alert. They don't see any notes that are associated with it. So class lists gives me that option. If I go and print my study hall lists, those will also give me the option for the health alert. And under grading more reports, either the grade entry or the grade verification gives me that option. And the reason they're under grading is some of the lower grade schools, like elementaries, might not have the full scheduling because everybody in the class moves together. So they don't really have a need for the major scheduling items. So in grade entry or grade verification, we again give you the opportunity to be able to print that. This takes a little longer to go in because of the other information. And here's where you have the include health alerts or not. So those are the reports. It's the grade entry and verification, class lists, study hall lists, or the biographic. Those are the areas where you have them. So if you had, say, a homeroom that was going on a field trip, that's where under the biographical list by field you can print it out to include and go with it. So it makes it nice for where that information is. I have a question about digitally sending the individual health plan and possibly 504s. When I do things like print the biographical list by field report or even in health, if I'm printing a health history when I come in here and I want to come in and print the student's health history report, I can say, well, go ahead and select all of it. Show me whoever has what. I'm ordering right now by the code rather than the description. And I can select the students I want to work with. So if I want to work with just Amy, I can select that. And what's nice is the output option. I can pick either PDF or Excel. And if I pick the PDF, I can specify where I want to put it. By default, it's going to go into my work area, but I can change this and go somewhere else, depending on what you have. Like I can go to a shared folder and go somewhere else. So it gives me that option. If I'm going to go to somewhere else, just be aware it's going to take a little longer to get there because of the network situation. Because this is on a different server than the one I'm on. But I could just say put it to my desktop because I have access to my desktop on this server. And when I click OK, it's actually going, and then print, it's actually going to print it. So it processed, it's going to come back and tell me it did it. So there's the look because I wanted to see it first. And I can go ahead and close that. And at this point, if I look at my desktop, I'm going to be able to see that health alert, that health history, and bring it back up. This report does include the notes. And I can take this file, it's a PDF, and email it to anybody I want. So if you have things like your 504s or anything, that's where the notes come in that you can work with. So it makes it nice to be able to come in and work with that. And if I'm done with it, then I can go ahead and delete it. And then I can empty my recycle bin so I don't have access to it additionally. So it just depends on what you want. Now, if you have gone to the output to change it to somewhere else, it's better if you come back to preview to screen when you're done. Because then you know the next time you print something, you're not going to send it to PDF, and I have done it multiple times. So this is where, and I'll go through it again, it's under Health, More Health Reports, and it's the student health history. This is where I can print who has what. Now, if I was looking for only students who had food or peanut allergies, I could come in here and say, give me either of those, or say, sort it by the description, and then they might be closer together. The default is I'm going to show both confidential and non-confidential codes. If I want to see which ones are just confidential, I can do that. I put chemical dependency and the oncological condition as being confidential. If I want to see the non-confidential, then I just check those and it gives me everything else. So you have the option. So here are my two where I want food or peanut allergy. I'm doing a complete health condition report. I'm not limiting it by a date range. I can opt, I want to do a new page for each student, and whether or not I want to include their contact information. And I can opt report title in here if I want. So I'm going to go ahead and print. And Amy's the only one with an allergy for peanuts, and I have nobody out there with an allergy to food. So it just gives me a way to see who's out there. Or it might remember I still only have Amy checked. So I'm going to go back and select everyone, all 500 and some odd students. And now when I print, it gives me the option to see everybody who has a food or peanut allergy. If you don't have, lunchtime is the name of our lunch program that we coordinate with. If you don't have that, but you want to be able to send these off to your lunch program, here's a way to give the student's name, their ID if they're using that, and what sort of allergy they have. Now somebody like Sean, because I didn't have the nut allergy before, or I have just peanuts, I would need to determine, like here, Kevin is allergic to peanuts versus Sean who's allergic to just nuts. So I need to go in and potentially change Kevin, so instead of food allergy, it's going to say allergic to peanuts. And I can do that. So if I look at Kevin Sikiel, I can go back up here and go find Kevin. I can do the stack of folders to look at the names. Type my SIK, and I want Kevin. So I can change this from the food allergy to the peanut allergy. The note can stay the same, or I can say, yep, I can get rid of the fact that they're allergic to peanuts and leave the EpiPen. So it just depends on how you want to put it out there. As easy as that. The other way to get the health history is when I go under Health, I can print the health student record listing. What this does is it gives me options or access to all of the different phases of health for the student. It's letting me know I have no preventive ed courses. Do I want to add them now? And I'm going to say no. So anything the student has, I'm going to see. So I can say just print my health history, or print office visits, medications, if I have anything in the tracking, immunizations, insurance providers, and any screenings that are done. You can start a new page for each student, or you can come in and say, I want to print each student one report. I want to do each report for one student at a time. And what that means, because each of these is a separate report, It's going to print all of this reports for one student before it goes to the next student in my student range. So it just makes it a little easier for me to work with. I could opt that don't show me anything except the health history, or maybe health history and immunizations. And if I don't want the screenings, then I can unselect all the ones that are here. And I did that by just clicking one of them and then holding my control key and deselecting. So when I print, I'm including my parent information. This would be, say, if the student was leaving the school and I wanted to be able to send the history, and I didn't mean to print everybody. So I'm going to, again, just print Amy. So it's going to come through and show me their health history and their immunization. So I'm going to get one page with the health history, and it's going to close this one and open a new one and give me a list of what their immunizations. And it even tells me that they are compliant for my state immunization requirements. So it's going to give me what information I have here. But that's the intent of how to work with that. Okay. The other place to print is under Health, More Health Reports, and there are the health tally reports. Because it might be at the end of the year or at the end of the month, you need to report things to the state, such as how many students have diabetes, how many students have asthma, and things like that. So if I look at my existing health history report, I'm looking at specific items here, and I'm going to show you how to build one of those up, and then I have a date range. And as I said, this date range is limited to 12 months. So if I go ahead and print, it's going to go through and show me by gender how many students have each of these conditions. So I'm showing different ones, and it's letting me see what they have. So I have 3 students that are ADHD, 1 with a bee sting, 1 with environmental, 2 with food. My peanut allergy isn't here because I wasn't showing that. So I can close out, go over to the student health history, and determine what am I going to be counting. If I want to just show allergies, if I could spell, I want to select all the grades I want to show. I can print a separate total for each grade, or I can leave off the grade totals. I can show it by month when I found out about it. And I can come in here and say, oh, let me see just my allergies. I'll even do it by month. And I'm going to leave off the totals by grade. When I hit the add, it adds it into my tallies over here. So there's my allergies I can click on. And when I print, it's going to give me by month when I was notified about the allergies. So I had 2 of them in August, 2 in September. And that's where it's showing me of what came in, and 1 in November. So it lets me see it by month, or I can show it by gender, male and female. And it all depends on what you're looking for. But that's the other way you can do counts. So I know for Pennsylvania they're tracking, back into the history, they'll be tracking things like asthma, cystic fibrosis, diabetes, Tourette's, different conditions that I can say, okay, here's my totals and you're off and running. So it's a nice, easy way to work with it. Now I also have I'm just going to use the X in the corner to get out. I have a question about uploading the information so they can see what's going on. So let me pull this down a little bit. They were hoping to upload their individual health plans and have them available for the teachers to view. The full health plan, we don't have a way right now to give that where the teachers could view it as far as that situation, because we don't have a way for them to see the note. And that way we can work with that. So they have a copy of the individual health plan for each student's teacher, with several copies. And that includes the plan of action that the teacher would need to know. We have areas where you can put in the note, just not an area where the teacher could go view it. that's where we have a limitation. We have not had that available. What I can do is put in an enhancement request to have the option of whether or not they can view a particular place, or add the notes to the list of saying, okay, here are the ones with the individual health plans, and here's the note that goes with it, which would give them that capability, or a way to print that. So I can add that for you and make it available, but that would be my only option right now. One of the things I haven't been going, and my tendency to forget, is when I'm in things like doing the health history, you can always go to your question mark, and the question mark is the help for what am I putting in. And it knows I'm editing the student health history, so it's going to bring me to that. You can learn more if it's allowing for the pop-ups and such, so I can see more about how to locate a record. But it's going to come through and show me how to add a record. You know, how do I print the report for that student, where I can hit the printer button when I'm in the Edit Health History, and it will print just that student. Or I can come in to say More Reports and print the Health History report, and now it's going to give me information on that. And as I scroll down, I'll be able to see what's here. So what does it mean between limit by the following date range with a starting and ending? Or how do I do a student range, the output option, and print? And each of these learn more is going to print more information. So for the print preview, it's going to give me what do my different buttons mean. If I'm doing an output, what are my different output options? And then I can learn more with how to do a student range. So it gives me information. And I can always, once I've stretched those out, right-click and go to print, or hit the print up here. Either one will let me print that health information. So it makes it nice where the help information is available for the health information. So it does give me the option. When I was working on certain things like adding the record, there is now a little record menu from the top, and this explains what my buttons mean in this toolbar. So I can go to the first record, I can go to the previous, I can locate somebody, next, last. I can print the student's profile, I can print the report. So sometimes when I'm adding, because my hands are already on the keyboard, if I wanted to add a record, I would just do a Control-D. Or if my hands are on the keyboard, I want to locate somebody, I do a Control-L. So I can click here, do a Control-L, and go find who I'm looking for. I'm sitting in the last name column, so I can start typing whatever I want in the last name, and it's going to go find it for me. And then I can just double-click on a student and bring their information up. You can also sort on any column and then search in that column. So if I know more the spelling of the first name than the last name, I can do it this way, because you have things like Caruso and some of the other names. Is it a C or is it a K? So this way it likes, yeah, I know Alana, and I can go find them. So it makes it easy for me to go work. A lot of the edits that we're working with, like health history, I can go to a multi-school group, such as my K-12 for all of my schools. It's going to show me not just the 500 students at the high school, but the 17 or 1,800 in the entire district, and I can still go into the health history and see what's here and go ahead and add. I can do the individual report on the student, but a lot of the other reports are not available in multi-school mode. I have to be in that particular school in order to print it. Let's go back to the individual school. So just, how do I work with information? So remember that you have the question mark for help. You can also go under help, either with frequently asked questions that sometimes apply to what you're looking for, initial setup, starting a new year. You can go to the table of contents that brings the whole thing up with this table on the left, and you just go down to your health jobs and then start exploring what's here. So it makes it nice to be able to work with that. The video learning that's up on our website, And there's also a forum on our website. If you go into Help About MMS, it's going to give you the hours that our office is open in New Hampshire with phone numbers, including the toll-free number for support. There's a fax number if you want to fax us something. There is a support email and access to our website that you can just click on, and that'll bring up whichever browser is your default. And in there you can then go in, once you've signed in the client area, which is your email address and a 5 or an 11-digit number that we can supply if you need it to let you in. There's an area where you can go that has a forum where you can post questions and have others come back and forth to you, or there's also an area up there where you can email us questions. So it all depends on what you're looking for. So thank you very much for participating in the webinar, and we hope to have you at another one. So thank you again.